Continuing here with factors that contribute to the emerging of new infectious diseases. So we already mentioned new strains, mutated strains. Here's another example given, Vibrio cholerae O139. One big thing about changes in bacteria that make them multi-drug resistant. So the widespread use of antibiotics and pesticides has caused much resistance. So now we have these antibiotic resistant strains. They're very difficult to deal with, and every hospital is afraid of vancomycin resistant bacteria, methicillin resistant bacteria. It's a big problem. Also changes in weather patterns, and well, we do have climate change going on. Example here is given hantavirus. When the weather patterns change, it can cause vectors to migrate to new areas or different areas. It can also cause a virus to have a different opportunity to then infect other host cells. Also, sometimes weather patterns can contribute for a virus to spread from animals to humans, so to become zoonotic. So there's different options here. More contributing factors, of course, modern transportation that contributes to the spreading of viruses very quickly. That's why they've limited the flight patterns. Most international flights have been canceled for the last 2 months, and that's probably going to continue because air travel in particular, as other modern transportation forms, they contribute to the spreading of infectious diseases. Here the examples given, West Nile virus, but we might as well just add COVID-19. Ecological disasters that contaminate drinking water, that could be a problem. War, of course, it's luckily something we're not dealing with right now, but then also expanding human settlement, the cutting down of the rainforests in Brazil. There's all sorts of things. Here's an example given of coccidiomycosis that they are spreading due to human settlement. Animal control measures. Here is the example given for Lyme disease. Of course, that one is transmitted by a tick, and so you could use different kind of insecticides to limit the spreading of the ticks, but then that will have also other implications. Public health failure, for example, diphtheria given here. I might want to add the current the anti-vaccine movement. That's also really contributing to emerging infectious diseases because you're losing herd immunity over time. Also, it gives you the mutated strains a chance to reemerge. So there's a lot of different things. And public health failure in this case would be that our public health agency, like the CDC in the United States, has failed to give out the correct recommendations. Talking about the CDC, the Center for Disease Control in the United States, that is the agency that keeps track of numbers of cases, reportable diseases, and they are the top agency for all the evaluation of epidemiological data and then giving out recommendations based on the data that they have collected. So epidemiology in general, that's the study of where and when disease occurs and how it is transmitted within populations. So an epidemiologist, I'm sure they're busy these days, they determine the origin or the etiology of a disease. They identify other important factors concerning the spread of the disease. They develop methods for controlling a disease, and they do assemble data and graphs to outline incidence of the disease. Right now, you hear a lot about Dr. Fauci. He's sort of at the forefront of informing the public about the data that the CDC has collected and the recommendations that are being given out. And then the governors of each state, they then use these recommendations to communicate that to the public, and they put orders in place to limit the spread of disease. And it's all based on the data that comes from the CDC, what they've collected, what they've learned. Now, then you also have these political influences that are, of course, everybody's worried about the economy too, and you got to make a living. But so there are these conflicting forces right now at work that you can see. But really, right now, we should listen to the CDC. They've collected the data, and these are scientists that are evaluating the data and making recommendations to keep you alive. How we're going to get food and pay our bills, that should be secondary right now. But hopefully, we can do that too. So here. A little bit here more on the epidemiology, sort of the starting point. Probably the first real epidemiologist as this guy, Ignatz Simha was. And I like his story. There's a book about him. It's a strange story, to be honest. He was working in Vienna in a hospital, a general hospital, and there were wards where they were delivering babies, which is a common thing women go to the hospital for, to deliver a baby. And so in the wards where the medical students and the medical doctors were delivering the babies, he noticed that the death rate from childbed fever was approaching 30% sometimes. And he noticed that in those wards where the midwives were delivering the babies, or where nurses or midwives would go to the houses of the women, and then there was a home delivery, the mortality from childbed fever was only less than 1%. So he noticed that there was a big difference in the mortality depending on who was delivering the baby and where it was delivered. And so he kept tabs on what these doctors were doing, where they were going before they delivered a baby, and he found out that a lot of the medical students, they were working downstairs on the cadavers of those women that had died from childbed fever, and then they were being called upstairs and told, oh yeah, next baby's ready for delivery. And so they were going, without washing their hands, they were going upstairs and delivering the next baby. And of course they transmitted the disease, the childbed fever, to the next woman, and then the next woman would die. So classic kind of transmission pathway. And so he was a tough sell, though, because doctors and medical students were pretty arrogant. They didn't want to hear that they would possibly be the cause of the death of these women. And so they denied it, of course. In fact, they fired him for telling them to wash their hands with lime soap, or it was like more like a bleach type of soap. And he was basically suggesting, he was trying to be gentle and kind of subtle about it, and said, hey, you should wash your hands if after you work on a cadaver before you deliver the next baby. And they didn't take it too subtle. They said, you know, what the heck are you telling us? But some of them did it anyway, and then the incidence of childbed fever deaths went down dramatically. And so they really didn't have much of a way of denying it. Instead of just accepting the truth, they fired Ignatz Simha, and then he ended up going crazy, basically. But anyway, he's considered sort of the earliest epidemiologist, keeping track of the progression or the transmission of disease and implementing measures to limit the spread of disease. So this guy right here. Also, John Snow, he mapped the occurrence of cholera in London and mapped it to a particular well that was contaminated and made a lot of people sick. So he's also a big contributor to epidemiology. And then the nurse, Florence Nightingale, she showed that improved sanitation decreased incidence of epidemic typhus. Basically same thing. So recognizing how a disease is spread and then implementing measures to limit the spread of disease. That's what epidemiologists do. So here is a piece of data that an epidemiologist would look at. If we have Lyme disease cases 1999 to 2013, you can see the incidence or the reported cases by year. You can see 2009 was a particularly bad year, but sort of you just follow the data. Once you have a reportable disease in the CDC, they will put these graphs together and follow the incidence numbers per year. Here's another description that's just the by month, Lyme disease by month in the year 2012. And you can see that in the summer months, you're going to have a lot more Lyme disease cases as opposed to in the winter months. So highest incidence rate will be from May to October, and then it subsides for the winter month and then comes back up for the summer months. And then here, This would be reported tuberculosis cases 1940 to 2013, and you can see that tuberculosis has been on the decline, sharp decline, although there is some concern of reoccurrence of multi-drug resistant tuberculosis, but so far we haven't seen a big kind of spike in cases, so an epidemic or worse, pandemic. Now here you can see different branches of epidemiology. Descriptive epidemiology, they're collecting and analyzing data. A typical example would be John Snow mapping the cholera incidence to a contaminated well in London. Analytical epidemiology, Florence Nightingale was that. She was analyzing disease to determine its probable cause and then implementing new procedures to limit the spreading of a certain disease. And experimental epidemiology, that involves a hypothesis and controlled experiments. Ignatz Simha was a good example for that, because his hypothesis was that the medical students were carrying pathogens in this case, and he didn't really know much about bacteria at that time. He knew that these medical students, they were carrying the disease from those women that had died, and now they were working on the cadavers. They were carrying it up back to the new patients, the women ready to deliver a baby. And so his hypothesis was that there's something that's being carried from the cadavers to the new women, and he did controlled experiments by requiring these medical students to wash their hands, and then he collected data and evaluated the data. Anyway, so the Center of Disease Control and Prevention, the CDC, collects and analyzes epidemiological information in the United States, and they will publish their findings in a report that's called MMWR, the Morbidity and Mortality Weekly Report. Here are two terms that you need to know. Morbidity means the incidence of a specific notifiable disease. That means how many people got sick from this disease. And obviously right now everybody's watching coronavirus, so they are collecting the data and keeping tabs on the incidence of this particular disease. So every test that comes back positive will be reported to the CDC, and they keep track of it. Mortality means how many people have died from this particular disease. So morbidity refers to how many people got sick or have this disease, and how many people have died from the disease. That would be the mortality. So the Center for Disease Control and Prevention, they get a report of all reportable diseases. There's a long list of notifiable infectious diseases or reportable diseases, and the physicians are required to report any diagnosis that they've made of a reportable disease to the CDC. The morbidity rate would be the number of people affected in relation to the total population in a given time period. So it's basically the morbidity that we just talked about, except expressed as a rate, so per total of the population. And same is true for the mortality rate. That would be the number of deaths from a disease in relation to the whole population in a given time period. Let's take a look at this list here of nationally notifiable diseases as of 2013. You can see there's a long list. You can take a look at some of these here. Includes a lot of sexually transmitted diseases. So here we have, and also here gonorrhea, also viruses such as dengue, hepatitis viruses, all of them, HIV infection, syphilis, tetanus, Lyme disease. So you can take a look at this and see what are reportable diseases, where the CDC will get a report every time a physician has diagnosed one of those diseases. And to finish up our lecture here on epidemiology, let's take a look at a clinical focus on healthcare-associated infections, so nosocomial infections. And here they're using methicillin-resistant Staphylococcus aureus, basically following two different strains, strain USA 100 and USA 300. 92% of the USA 100 would be associated with healthcare, and 89% of community-acquired strains of methicillin-resistant Staphylococcus aureus would be USA 300. There's a test that you can run in order to grow Staphylococcus aureus. It grows here on this MSA agar. When grown on mannitol salt agar, so MSA agar, you can see that the Staph aureus will change the color because there's a pH indicator in here, and the growth will turn the agar yellow from previously being red. Here, just to finish up, just to give you some ideas of the numbers here, methicillin-resistant Staph aureus infected patients, the numbers are listed right here. A lot of patients get infected via IV catheters, surgery, urinary bladder catheters, and ventilators as well.